So we are back again with the another informative videos. As we had discussed earlier that there are various factors which are responsible for infertility. So today we will discuss what is the role of female factor. And female factor also there are four kind of factors. So we'll start with one by one. So today our focus is on the ovarian reserve. As you must be aware that how a baby is formed. Embryo is the smallest form of baby, so it is the beginning by which we can expect a new life to come in the universe, in the world, inside the body of the prospective mother. So for baby to be formed, that is embryo to be formed, we need egg, sperm, and it needs to be implanted, that is fixed onto the healthy uterine cavity or the womb. So what decides like what are the chances of a female to have pregnancy? So first thing is we do an assessment that is called as ovarian reserve assessment. That comes as part of the fertility screening also. Like it should be the first step. Okay. So there are 2-3 factors which we consider. First is the clinical, that is like what is the age of female, how is her periods, how is her medical history, she is on to any medicines which can affect the reserve, she had any previous surgeries, any complications she had went through which can affect the anatomy and indirectly the reserve can be affected. Okay, so ultimately other than the clinical, then we next step is to go for the sonological parameters. Sonological parameters means that is the ultrasound assessment, like we check what is the antral follicle count, that is the AFC, that is done by a transvaginal scan, that is the internal scan, that is most preferred, provided the doctor should have the skill and the experience in that. And we see like how many follicles you have. So based on a certain cutoff as per the age of the female, we decide like what are the prognostic factors. Then the other and the most specific prognostic factor is the biochemical parameters, that is the AMH. So AMH is an anti-Mullerian hormone. It is a blood test and it can be done on any day irrespective of the periods. Besides that, there are certain blood tests which are done on the day 2, day 3 of the periods, like FSH, follicle stimulating hormone, LH, that is luteinizing hormone, and E2, that is the estradiol. So based on these 3 parameters, besides the clinical acumen, your doctor will tell you like what are the chances and which protocol you should follow and which treatment hierarchy should be followed. Hope it has given you a gross picture like how the assessment is done. See, if your things are clear, you have the information, you have the knowledge, then you can take your call in a right way. See you in the next informative video in continuation. Okay, thank you.